Another important field, mainly related to the availability in the near future of these monoclonal antibodies against Alzheimer's disease, is that MRI will play a very important role, a critical role in monitoring these patients, because MRI is highly sensitive for detecting some adverse events related to this treatment. This means that we have to perform a lot of MRIs, and we need for that a very standardized and abbreviated protocol to be easily implemented in clinical practice. But in addition to that, we need some tools that help us in detecting these adverse events related to the treatment, such as the different types of ARIA inside the parenchyma and in the meningeal region. So I think it's extremely important to standardize the protocol, also educate radiologists to detect these complications. And obviously, this is a time-consuming task, and we need some automated tools that help us in detecting these events.
ARIA-E can be difficult if it's subtle, for example, only a sulcal effusion, which is not super hyperintense, but only sort of iso-intense to gray matter, which you can nicely see on a subtraction image, but with the naked eye, it's not easy to see. Similarly, with ARIA-H can be difficult. It's always confusing with vessels or veins. So ARIA monitoring, I think, is a good example where AI could help, because that is typically done with a standardized protocol. And it's a bit of a boring job for radiologists, because the vast majority of these scans are negative. So let's say 90% of the scans that you will do, even with a drug that produces 20% ARIA, means out of the 5 scans that the patient has, 1 of them will have ARIA. So in reality, it's not 20% of the scans with ARIA, it's only 5% or perhaps 3% of the scans will have ARIA. So you have to look at 100 scans to find 3 with ARIA, so 97 that are normal. And I think, having a second pair of eyes would help to alert you, make sure that you don't miss any of them.
So the pitfalls in assessing ARIA, I think this is kind of a big answer. There isn't a lot of information out there yet. We're just now hearing about this, even though it's been around a couple years, really in the academic centers. Maybe some people know, there are some webinars, there's some, lectures at meetings. But most people out there, even at academic centers, let alone in the community hospitals, ER, general radiology, most people don't even know about it. So number 1, the pitfall is people don't know what to look for. Number 2, it's subtle. And so even experienced radiologists, and I experienced this myself at RSNA, we had 3 neuroradiologists who do know about ARIA, who looked at a case and gave 3 different answers about whether, the existence even, if there was even ARIA-E or not, let alone the grading. So pitfalls would really be, I would say, lack of awareness, lack of education, lack of agreement. And I think if you had a tool that actually did it consistently, based on expert opinion, that would help us mitigate some of these problems.